More than 40% of New Jerseyans who lost their battle with COVID-19 have been tied to long-term care facilities, resulting in staffing shortages, leaving many facilities to sound the alarm for help. The senior company, which provides in-home care to seniors, deployed CNAs and health aides to facilities throughout North Jersey.
So we got a staffing license from the state. We're aggressively recruiting. We use a lot of our current aides, and we actually doubled our staff over the last 2 months in an attempt to staff up and help staff the facilities. We've hired CNAs, home health aides, and help these facilities give the proper care that is needed.
Shortages came as staff either feared contracting the virus in their workplaces or tested positive for COVID-19, putting them out of work for weeks at a time.
We heard that the facilities did have a big need for staff. A lot of people were either getting sick, they weren't showing up for work, and the patients in the facilities were not getting cared for properly. And that's all over the state, all over the country.
The senior company ensures their caregivers on the front lines get the proper PPE needed before entering facilities or seniors' homes.
What we have done is make sure that they are getting the proper PPE. We've had over 150 aides or CNAs go into facilities over the last 2 months, and we've only had 2 reported cases out of all of those.
Because we have a stop, drop, and call us rule. When they would go to a facility, especially in the beginning, it was still the logistics. They had the PPE, but the logistics were still a little crazy. So until they got the correct PPE, they were supposed to call us and they did that, and it worked. It was, I think we were that support system for the caregivers to make sure that they had a voice.
In-home caregivers are required to be tested for COVID-19 and complete health screenings before they can work.
It's important that they understand, that the families understand that we are taking every precaution. Knock on wood, we haven't had anybody in the home, actual seniors in the homes, get sick.
The healthcare agency says they continue to staff up and prepare for the wave of discharges from rehab facilities and hospitals. In Totowa, Heather Fordham, New Jersey News Network.